that other. Rotate you a little bit. Come right through this. There you go.
Okay, I tap.
There you go. Guys, welcome to Hometown Integrated Medicine. This is Dr. Dylan here with Chris Wickiser, kind of a local buddy of mine in town, a local fireman, and then quite the strength athlete as well. Shoot, what were we like? Dang near National Strongman, like Fireman of the Year, right?
The firefighter strongman.
Yeah. He's quite the athlete. So what we're going to do, he's dealing with a little bit of anterior pelvic tilt today, and it's not promoting his lumbar flexion. So what we want to do is really work on his pelvic tilt, and then he said his left big toe was kind of bugging him as well. So we're going to start working into his extremities and his feet and stuff like that too. We'll go face down to start, Chris. We'll check things out. Chris mentioned that he went to pick up a dumbbell at a weird angle and then started to feel kind of a tweak. So we'll kind of see what's going on. It might be a little bit of like a lateral component too with the way he was reaching. You're not the first one when this is going on to say it's just hard to even lie face flat, you know, just doesn't want to really push into there. And we're definitely favoring that right side with a good bit of rotation, the way he grabs, so we're gonna bring it the other way. Right, I always come down and look at the feet and I check out to see if the leg lengths are a little bit different. And right now what we can see is we got a right leg that's about a ½ inch shorter than the left one, if you kind of look at the bottom. What we do is we take the knees out of the mix just to make sure it stays that way. And then that way it shows us it's truly coming from the hip. And you can see still his right's a good bit shorter than his left. So let's correct that for sure. Work smooth. Get a good tissue pull in, then we're gonna bring this kind of that way. A little more rotation in there. One thing I always check too, which is why I'm kind of going right under Chris's butt cheek, is the femurs and the way the hamstrings attach into the lower part of the pelvis can play a huge role in that kind of anterior tilt component. So what I like to do is make sure the femurs get aligned right in there as well. There we go, now we're rocking a little better. And what dang near always happens is that L5 likes to follow our pelvis a little bit. Bring that guy over. There we go. And now I'm just going to kind of keep working my way up. Big breath in on this one, Chris, and let it all the way out. Just because I'm so close to his diaphragm, I really want to get all that air out of him. That is because of the psoas connection all the way up into L1 and L2. These big hip flexors actually come and insert into the backside at these highest vertebral levels. So surprisingly, sometimes when our L2 or L1's really out, we actually feel it down low, which is kind of interesting. A little close to that diaphragm again. I'm gonna have you do another big old breath right here, Chris. Letting that all the way in, then all the way out for me. Let all that air out. Here we go, brother. There we go. Another big breath right here, Chris. And this one's just to let that relaxation kind of come in. There we go. Just staying nice and relaxed. We're going to kind of bring you into tension and really just come through this mid-back area. There we go, brother. Good rotation. With all the press is going to come right through that other hand, not really the neck. There we go. There we go. Getting all things. You're moving well, Chris. Couple tight spots, but you're sliding in. And we'll lean you right on back. And I'm just going to kind of cup your head here and see what's going on. Check a little bit of that glide, and we're a little restricted on that glide that side. So what we'll do is we'll get this C4 guy first. Maybe take this here and just kind of drop it right into my hand, Chris. There we go. And we're just going to kind of rotate you a little bit. Come right through there. Good job, man. A couple tighter spots up through this guy.
Yeah, I used to have a lot of that problems. You cleared them up most of it. I haven't any information at all.
How much you got to wear that heavy helmet?
Not too bad. I take it off as soon as I can.
Are you done with it?
I hate that thing.
It's tough on the neck, man,
Yeah.
that's for sure. Really taking that, bending that guy right in, and we'll just glide right through this. There you go, Chris. Well, that being said, are you getting any neurology that's kind of going down your legs?
Not really. I felt some like groin when seated.
Okay.
When seated, sometimes I found like putting like a wide base, let it relax.
Yeah.
Does that make sense? Like sitting, being able to sit into it where if I'm, what is that, pronated? My legs are pronated, I feel like it won't sit back.
Okay.
Does that make sense?
Totally.
Okay.
And one thing I was planning on or thinking about doing was some flexion on you, but I don't think a lot of what you have going on is actually coming from your disc spaces. And I don't want to flare them up by pressing on them too hard. If you were getting crazy sciatica coming down through here, what I really want to do actually now is just a couple more pelvic adjustments to you and then leave the lumbars alone because I think they're feeling better.
Okay.
And these can be really great for what Chris has going on. These are called anterior tilt adjustments. So what we're going to do is just rock that pelvic into place a little bit, or pelvis into place a little bit. Let's bring this down. He has much better rotation from when we got it from the back side, but we got to help a little bit more with getting this tilt in there. We're just going to come in, kind of rock stuff into place. These can be a little tender because you're right on those psoas muscles. And then one more good old rotation. There we go, brother. That was the guy. You have an iliacus here. Let me take it easy on that guy. I want to do a couple more. No, you were doing good. But that is actually tighter than I was realizing when we got face up. Too. Already? Yeah. You down for a little muscle work action, Chris?
Yeah, we'll try.
I'd like to dig into this guy first, and then we'll hit in the bag. Acupressure kind of release tool.
Okay.
So you'll feel some tenderness in these moments, and then I'll kind of keep an eye on it so it's not just going crazy, but we're not going to miss, Chris. We're going to get right on it, man.
Yeah, I feel it. It's not bad, but I feel it. Oh.
I was gonna say, then I'm getting into the iliacus a little more, and that gets us for sure. I'll tell you what, folks, the way I'm seeing low backs nowadays, 8 out of 10 got really tight hip flexors going on. So if you're in low back pain, sometimes it's good to focus on stretching the hip flexors a ton. When we're in a sitting position, these 17 to 16 inch muscles get contracted to about 14, 15 inches, depending how long you're sitting for, what other factors you got going on. Sometimes they don't want to really let go and let you stand up completely. Hence the reason why we sometimes get stuck kind of slouched forward. What's happening a little bit too is because Chris's iliacus and psoas are a little bit overcompensated or like over-facilitated, the sartorius that's coming down is now starting to kind of compensate. It's technically a thigh muscle, but it's kind of a prime flexor of our hip as well, especially when the other muscles aren't really working the way we want. So I'm gonna go even a little bit lower and trace out his sartorius a little.
Pull that up.
Sure. And this is okay with you right on the skin?
Yeah, it's
okay.
Good. I feel it.
Oh yeah.
You're not wrong, it's tight.
Yes, sir. One of the longest muscles in our body and one of the only ones that crosses over 2 joints. So it can play a huge role. So I've done a little AccuRelease, and now I'm gonna kind of get it with my fingers a little bit more.
That loosens me up a lot though.
Yeah, man.
I wouldn't even want to tolerate this.
No. Yeah, now we're getting really into what they call the ASIS, the front of the pelvis here. That's where a lot of big muscles insert, and it's probably where he's the most locked up and tender. Tough. What we're going to do is I'm going to have you do this motion. I'm going to have you flex your knee and kind of doing a complete, like, you know.
Gotcha. You're going to hold pressure on that?
Yes, sir.
Gotcha.
Yep. So give me a nice little, like, kind of lower crunch.
You ready?
Yes, sir. And then straighten that guy out. I'm going to kind of resist you. There you go. Yep, just straight her out. Take your time, no rush. Good job, Chris. And we're just lengthening stuff out. Getting right to the money. Good job, brother. Let's do another quick bend. Yep. And then get on that outside a little bit more. There we go. There you go, Chris. There you go. Not easy, Rick. There you go. Good job, man. Let's do another one. Getting a little more iliac psoas mix.
Good.
Yes, sir. Yeah, just straightening that guy out best you can. It's gonna feel like air after this. You're doing a lot of hard work right now, Chris. It's good stuff. Nice, dude. Let's get a little bit more up on the top. This guy. There we go. We found a spot, huh?
Yeah, I think so.
Let's be nice and easy into this guy. Take your time. We'll be nice and easy. This one is really producing a lot of pain on Chris, so we're taking it chill. Take your time. Let's see how you're standing up. I was gonna say, if you want to do a quick bend, any different ball game.
Yeah,
Cool.
completely.
Cool.
Wow. All that. I mean, I still feel like my erectors were like overcompensating, I guess, maybe.
It's the component that usually, like when these guys don't want to let go, they strap on hard.
Yep.
So sometimes, especially with a gout presentation, we got to do a little bit of a lateral pull. But this is actually just getting you more on this flexion in here. Let me grab a towel so I don't slide off you. There's not too much there. I'm going to get up in there and get a good grip of Chris's toe. Then what we're going to do is bring it into, it already kind of released, so we're going to bring it into flexion and come a little more that way. And what I want to do is a quick little pull on this guy here. Let's switch it up to the other hand. I want to do a quick little lateral break up too. Sorry about that, Chris. The lateral ones get tender. And then one more, just really pulling on this flexion. Good job, Chris. There we go. Can you actually feel relief in the ankle too? Cool.
The ankles will pop in
Well, can I check your ankle too?
Yeah, go for it.
Cool.
Too much trying to swing a golf club too hard.
There you go. It's usually this talus guy that gets us. There we go, Chris. Let's see if that's like continues to pop as much.
Yeah. Oh yeah, much better.
Better plant.
Yeah.
Cool.
Yeah, that's what it is. Appreciate it.
We appreciate you, Chris.
Yeah, thank you.
No problem, man. No problem.